Okay. Maybe I should get my hair out of my face.
Okay, should we start?
Okay, over the next 2 weeks, we're interviewing people to help us test this interview. The interview asks about the care you received from the Cunningham Clinic. Sometimes I'll ask you follow-up questions about how you chose your answer.
Okay.
These questions will help us to learn where and how we can improve this interview. The interview should take about 90 minutes, depending on you and your health experiences. And if you need to take a break at any time, please let me know.
Okay.
This project is funded by the Hayes Foundation. If you want any additional information about this project, please contact Leo Morales, and I have his phone number and extension here.
Okay.
Before we begin, I want to reassure you that we will keep the information you give us confidential. Your doctors and health plan do not know you are taking part in this interview. Your name is not written on this interview, and your name will not appear in the report we write summarizing these interviews. It would be helpful to me if I taped our interview. Is that okay with you?
Yeah, that's fine.
So I'll go ahead and start the interview.
Okay.
Our records show that you get your medical care from the Cunningham Clinic. Is that right?
Yes.
Okay. How many months or years in a row have you been going to this clinic? Was it less than 6 months, 6 to 12 months, 12 to 24 months, 2 to 5 years, 5 to 10 years, or 10 or more years?
No, it's I switched health plans back in March, not of this year, but the year before,
Okay.
and so we were assigned to this clinic. So that's how many months? That's April, May, 14 months.
Okay, so that would be in the
13
12 to 24 month
Right.
category.
Right.
A personal doctor or nurse is the health provider who knows you the best. This can be a general doctor, a specialist doctor, a nurse practitioner, or a physician assistant. Do you have one person you think of as your personal doctor or nurse?
Do you mean my regular doctor?
It's any doctor who knows you the best.
Well, he's the one that I see the most often, so I guess. You mean the one that was assigned to me by my health plan?
Well, who's the doctor or nurse who knows you the best?
Well, he would be. He's the one that I see whenever we have a problem.
Okay, so you have one person that you think of.
Right.
Okay. And is that person a doctor or a nurse?
He's a doctor.
A doctor, okay.
Do you need his name?
No, that's fine.
Okay.
Is this the person you see for all or most of your medical needs?
I see him for everything except my annual OBGYN exam.
Okay, so that'd be...
I go, through my health plan I can see an OBGYN without getting a referral for my annual exam.
Okay.
So, yeah. So
Other than that?
Right.
Okay. Does your personal doctor work at the Cunningham Clinic?
Yes.
Okay. With the choices that your medical group gave you, how much of a problem, if any, was it to get a personal doctor or nurse you are happy with? Was it a big problem, a small problem, or not a problem?
It wasn't a problem. I think we lucked out because we picked them from a list. So.
Oh, you picked your doctor from a list?
Right.
Where did you get the list?
The health plan mailed us a list of doctors in our area that we could pick from.
Oh, great. So they mailed you a list.
Right.
Great. We want to know your rating of your personal doctor or nurse. Use any number from 0 to 10, where 0 is the worst personal doctor and 10 is the best personal doctor possible. How would you rate your personal doctor now?
What score can I give it?
0 is the worst personal doctor possible, and 10 is the best personal doctor possible.
I would give him an 8.
An 8, okay. Please give me your overall rating in another way. Would you say your regular doctor is very good, good, okay, not very good, or not good at all?
He's pretty good.
Pretty good. Would you say that's a good, or a very good, or
Good.
a good? Okay.
I wouldn't say he's very good.
Okay.
He's just good.
This question is almost the same as the one before it. Which answer choices were easier for you to use? The very good to not good at all, or the 0 to 10 scale?
About the same.
The same? Okay. Please give your overall rating of your regular doctor in still another way. Is he excellent, very good, good, fair, or poor?
Good.
You'd say good. Compare the last 3 questions. That would be the 0 to 10 question, the very good to not good at all question, or the one I just asked you, the excellent to poor question? Which do you think is the best for you to use in rating your regular doctor?
Well, the last two seem the same,
They seemed the same? Okay.
right? Weren't
Could
they
you-
the same question?
It's almost the same. The answer choices are slightly different.
Okay. Whichever you want to use is fine.
Okay.
I
They're
don't have
pretty
a
much-
preference, yeah.
Okay. These next questions are about the healthcare services you received in the last 6 months from the Cunningham Clinic. Thinking about the healthcare services you received in the last 6 months from the Cunningham Clinic, how would you rate the following? Explanations of medical procedures and tests. Would you say they were poor, fair, good, very good, or excellent?
They were fair.
Fair, okay. And
They
what
don't really explain what the procedure is for.
They don't?
No.
Okay.
Because they were testing me for allergies, and I mean, they drew blood, they did all these things, but they didn't really explain. I mean, I know it's for allergies, but I don't know exactly what it is that they were doing.
Okay. So they weren't clear on
No.
what they were doing to you.
Right.
Okay. Did any of your doctors at the Cunningham Clinic explain a procedure or test to you in the last 6 months?
Well, Dr. Serrato does, but he's just, he goes through it very quickly, and I guess he thinks I don't understand medical terms or something, but anyways, he just doesn't spend a lot of time.
Okay. So they
Explaining
have
things.
explained something to you in the last 6 months, but it really wasn't clear?
Right.
Okay. Did you think only about visits to the Cunningham Clinic when you answered this question?
Right. It's the only place we go.
Okay. And what would have to happen for your rating to improve?
He would have to explain things a little bit more clearly, and I mean, if he had like written information, that would be good.
Okay. So he could hand you some sort of
Right.
pamphlet
Or yeah, something like that.
explaining. Thinking about the healthcare services you received in the last 6 months from the Cunningham Clinic, how would you rate the following? The outcomes of your medical care, or how much you were helped. Would you say it was poor, fair, good, very good, or excellent?
Good.
Please repeat that question to me in your own words. Would you like me to read it again?
Yeah.
Okay.
Sorry, I wasn't paying
That's
attention.
okay.
I promise
Think-
I'll pay more attention.
Okay. Thinking about the healthcare services you received in the last 6 months from the Cunningham Clinic,
Okay.
how would you rate the following? The outcomes of your medical care.
Okay, so you want me to repeat it to you?
In your own words.
Oh, in my own
Uh-huh.
words. Okay, so in the last 6 months, how well the Cunningham Clinic has provided medical services.
Okay. How well. What did you think of when you chose your answer? You said the outcomes of your medical care were good.
Because they're generally, pretty good. I mean, they're very professional. They answer phone calls. I get an appointment fairly quickly. I mean, they're pretty good.
Okay. And what does outcomes of your medical care mean to you?
It means a lot to me.
What's your definition of outcomes of your medical care?
It's how good the medical services that are provided to me are.
How good the services are.
Right.
Okay. Did you think only about visits to the Cunningham Clinic when you answered this question?
Yes.
Okay. And what would have to happen for your rating to improve from a good to something higher?
The doctor would have to spend a little bit more time with me, and if he explained things a little bit more clearly,
Okay.
then I would be happier. I
Great.
mean, overall, I'm pretty satisfied, but he could improve on those two things.
Okay. In the last 6 months, did doctors and staff spend enough time with you during your visits?
Well, yes and no. I mean, my regular doctor kind of does. I mean, it's adequate, but my OBGYN really doesn't. I mean, it's like he's in and out of there in 5 minutes.
Okay.